And apologies, folks, I'm just trying to work my computer system here. 1 minute. Um, Tammy, there it is. There we go. Think you are seeing, Elena, are you seeing the PowerPoint presentation? Okay. Let me check here. All right. So it is about 3:04 today, so I think we're going to go ahead and get started today. Um, Tammy, if you can start recording for us, we're going to record this session so that we can post this training on the My Choice Matters website for people to view at a later date if they weren't able to attend today. So welcome everyone. I'm so glad you were able to join us today. This is the My Choice Matters discussion for understanding budget add-ons. Just a few reminders about kind of the process for this training today. We want you all to know if you have questions for us, please feel free during this process. You can type any questions that you have into the chat box in the WebEx feature. We're monitoring that chat box, so we'll be able to see your question there. If you prefer to ask your questions, you can always click the raise your hand button on the video panel and raise your hand. And when we come to a pause in the training, we'll be able to unmute you so that you can ask your question out loud. As I mentioned earlier, a copy and recording of this presentation will be posted on the My Choice Matters website. The slides that we're presenting today should be up on the site fairly quickly. It takes us a little bit longer to get the videos and the recording of the presentation posted, but just bear with us and we will also get that uploaded onto the My Choice Matters website. After this training is finished, we'll have a link to a survey so you can tell us what you liked about the presentation, what you didn't, and what other information you may need to want to know about the new model. Okay, so today's training is focusing on budget add-ons. Budget add-ons are the way that people can get supports and services beyond what's accounted for in their budget that's assigned using the new model. So this is a way for people to request additional dollars for additional supports that they may need that aren't covered under the initial budget amount that a person receives. Budget add-ons could also be called budget modifications. There are 3 types of budget add-ons that an individual could request. You could request health and safety services, You could request employment services, or you can request budget modifications to address a health risk or a safety risk. And we're going to review all of these during today's training. I think it's important to note real quick right here that these budget add-on requests are not appeal requests. These are things that you can ask for when you submit your plan. So they're not appeals in the way that perhaps these requests have been in the current system. Okay, so where do budget add-ons or budget modifications fit into this process for when you're kind of requesting DD services? So if you've been to some of our other presentations, you know we've walked through that process as our application process, where initial applicants will submit an application. You go through the assessment process with our Liberty assessors to have the Vineland and the CIS-A assessment, and you get those results. And then based on your assessment results and some choices that you make about the services you want, you would get a budget. Once you have your letter that tells you how much your budget is, then you would develop a plan. When you develop a plan, that's where in the new system that you would be requesting those budget add-ons or budget modifications. And so you submit your plan with your budget add-on or budget modification request. And once that plan is reviewed and approved, then you would be able to get your services. And then if something changed mid-year, you needed different services or something about your circumstances changed, you would be able to make changes to your plan and to your services if needed. So again, just remember that as we're talking through this, we're talking about what changes you can make as you're writing your plan. Okay. So just for those of you, if you haven't kind of joined in, or just as a reminder for those of you that have, we're just going to talk for just a minute about how the new model works. When the new model begins, you get a budget notice that tells you your budget. And those budgets are based on an individual's support level and your service mix. So your support level is the level that's identified based on your assessments. So the individual would go and have a CIS-A assessment during their assessment process. And the department will look at the total scores on this CIS-A assessment. We look at 3 sections and we add up the score. And depending on that total score, an individual would be placed into level 1 for low support needs, level 2 for moderate support needs, or level 3 for high support needs. An individual could also request to be verified or to go through the verification process for level M or level B. And what that means is that if an individual thinks they have or believes they have extraordinary medical support needs or extraordinary behavioral support needs, they can essentially ask for the department to review those support needs. And if those needs are verified, then the individual's budget is based on that level M or level B. So again, when you get your budget is based on your support levels, so levels 1, 2, 3, M or B, and the service mix that an individual chooses. The service mix is based on, there's 7 different service mixes that we have available. We have the state plan HCBS only service mix, and that's for those folks who don't qualify for our waiver services, but do qualify for the state plan services. In the new model, those state plan services are going to be the developmental therapy, community habilitation, non-medical transportation, and those sorts of services. The other service mixes are based on whether or not someone chooses to receive services through the traditional pathway or through the self-directed pathway. And it also depends on the participant's choice of what type of residential supports they want. So we have a certified family home service mix, which is for traditional participants who receive residential habilitation from a certified family home provider. We have a community-only supports service mix that's for traditional participants who receive no in-home habilitation services. So these are for the folks that choose not to have supports in their home. We also have a supported living service mix for traditional participants who receive residential habilitation from a supported living provider. And then we also have 3 service mixes for those individuals who choose the self-direction pathway to receive services. And that is self-direction, the SD live-in supports for self-direct participants who receive in-home habilitation from a community support worker that they live with. There's SD community only supports, which is for self-direct participants who receive no in-home habilitation supports. And there's SD outside supports for self-direct participants who receive in-home habilitation from community support workers that they don't live with. So again, based on the support level and the individual's choices about how they want to receive their services, the individual gets a budget. That budget is intended to cover supports and services in 3 areas: residential supports, discretionary supports, and planning supports. On the traditional side, if individuals choose the traditional pathway, the individual can choose from residential supports. They can again choose no paid residential supports. They could choose certified family home, or they could choose supported living services. The discretionary support choices for individuals in the traditional program include the adult day health, developmental therapy, a new service called pre-vocational services, a new service called career planning services, a new service, community habilitation service. Individuals could also choose non-medical transportation. Individuals who do not receive paid residential habilitation services in their home could also choose respite or chore services as supports. The service coordination and planning portion of an individual's budget on the traditional program would cover service coordination and plan development. On the self-directed side, those buckets of residential, discretionary, and planning are lumped together so that an individual has one budget amount, but in that one budget amount, self-direct participants could buy community support services, those personal supports, the learning supports, emotional supports, relationship supports, and transportation supports. You would also be required to purchase those support broker services and the fiscal employer agent or the financial management services. And so those are the things that individuals on both the traditional pathway or the self-directed pathway would spend their budget dollars on. So when you get your budget letter and it has your budget amount, these are the types of services that you would be purchasing. In addition to those services that you could purchase under your budget, there are also those health, safety, and employment services that an individual can purchase and request additional dollars above their budget amount to cover the need and to cover those services that meet their health, safety, and employment needs. So let's take a look at that for just a minute. So the traditional health, safety, and employment services are the skilled nursing service, the specialized medical equipment and supplies service, environmental accessibility adaptations, behavioral consultation, home delivered meals, personal emergency response systems, crisis intervention services, transition services, supported employment, and non-medical transportation for supported employment. On the self-directed side, those health, safety, and employment services are employment support services, so your job support services, any adaptive equipment, and any specialized nursing services. So again, these are services that would not be deducted from the budget that you receive based on your assessment, but that could be added to the individual's plan that can be approved by the department so long as you meet the criteria for that service. And further down in this presentation, we're going to go over each service and what the criteria are that need to be met to receive those services. Okay. One other quick point, when you get your budget notice, there will be an attachment that is included in every budget notice that tells you the health, safety, and employment services that are available to you. So if you request traditional services, you'll have an attachment in your notice that tells you the services that are available to you and the criteria that you need to meet to receive those services. And the same is true for the self-direction services that are available as health, safety, and employment services. So with that, I know that was a lot really fast just to kind of update everyone and bring everybody to the same page. Just wondering if anybody has any questions for us today.
Karen, I see one question has come in so far, and that is, why is behavior intervention and crisis services not available to self-direction? I'm happy to take a shot at answering that if you'd like.
Sure.
And that is, as we'll go through later on in this presentation, behavior intervention and crisis services are absolutely available to individuals who use self-direction. The nature of self-direction is simply that the categories that are used for self-direction to identify the kinds of services that are being obtained are different than they are on traditional. But later on in the presentation, we'll actually provide a quick crosswalk to show you how you can get all of the different types of health, safety, or employment services that are listed out in traditional when using self-direction services.
Great. Thank you, Alina. I'm not seeing any hands raised right now either. So I think we'll go ahead and move on to the next section of the presentation. Yep. Okay, so now we're going to talk about each of the traditional health or safety services and the criteria needed to be met to receive those services. So
I'll just chime in super quick, Karen. So sorry to talk over you. Thinking back to the previous question, that do keep an eye and listen to this portion of the presentation if you use self-direction services, because the kinds of documentation that are required to get the kinds of these services on traditional are very, very similar to the kinds of documentation that are required if you like this kind of support using self-direction. So most of this information is also applicable, and we'll show you on a later slide where that connection exactly is.
great. Thank you, Alina. And I did receive one more question that asked, before we get started on these services, that asked, who is the fiscal employee service? And so the fiscal employer or the financial management service, the fiscal employer agent, you also may hear it called an FEA, is the entity for those self-direct folks who helps you contract with your community support workers. And then your community support worker time cards are submitted to the fiscal employer agent, and then they're able to make the payments for the services under the self-direct program. The fiscal employer agent their fee is paid on a monthly basis, and the cost of that fee for their services is included in the self-direction budgets. All right. So now we are going to move on to the health or safety service criteria. Skilled nursing and nursing oversight. This service includes intermittent or continuous oversight, training, or skilled care that's within the scope of the Nurse Practice Act. In order to receive skilled nursing services, you would request, show the skilled nursing services on your plan of service. And when you submit that plan, you'd also want to submit a referral from a physician or other practitioner of the healing arts, and you would submit a nursing plan of care with your ISP. And when we have those two things, we'll be able to approve the skilled nursing services that you needed. The next service we want to talk about is the specialized medical equipment and supplies. This service includes devices or controls or appliances that enable a participant to increase their ability to perform activities of daily living or to control or to communicate within their home environment. It includes medically necessary equipment or supplies that are not covered under other insurance plans. So specialized medical equipment is a lot like the durable medical equipment that's offered by the medical care unit under your Medicaid medical care card. And so basically what the specialized medical equipment offers is if the equipment that you need is not covered as part of the durable medical equipment, you can request coverage through the waiver. And so before we can approve specialized medical equipment on the waiver, you would have to request coverage from the durable medical equipment and get a denial as DME. And the medical care unit would provide that letter or that denial for you. And once you have that denial, then you would be able to request the services from and use some of your waiver dollars for those services. There are a few exceptions that you would not need a denial letter if you were requesting diverter valves for a bathtub, if you were requesting eating and feeding utensils such as rocker knives and special plates with rims. You would not need that denial letter if you needed lift devices or wheelchair lifts for a van. But other equipment, we ask that you first go through and request coverage under your medical card as DME. And then if it's denied, then we can review it as specialized medical equipment. Additionally, for specialized medical equipment, we need a letter from a physician or other practitioner recommending that the specialized medical equipment, how it is related to the individual's developmental disability, and the reason that it's being recommended. Oh. Go back one. The next service that we want to talk about is behavioral consultation and crisis management. This service provides direct consultation and clinical evaluation of participants who are currently experiencing or may be expected to experience a psychological, behavioral, or emotional crisis. This service can also provide training for staff development related to the needs of the participant and can provide emergency backup involving the direct support of the participant who is in crisis. The documentation requirements for this service, you would need to submit documentation to support that the participant is experiencing or is expected to experience a psychological, behavioral, or emotional crisis. And these are reviewed on a case-by-case basis as these requests are submitted. We also have home delivered meals, which are meals delivered to the participant's home to promote adequate nutrition. An individual can get 1 to 2 meals per day, um, as long as the individual and these services would be approved if the individual meets all of the following. So they have to rent or own a home. The individual must be alone for significant parts of the day. The individual must have no caregiver for extended periods of time, and the individual must be unable to prepare a meal without assistance. And so when you submit your plan, if you can document that you meet these criteria, then we'll be able to approve the home delivered meals for you as well. Traditional health or safety services, the next service is personal emergency response system. This is the electronic device that enables a participant to secure help in an emergency. These are the types of services where a person may wear a help button to allow for mobility, and there's a response center that's staffed by trained professionals. So if an individual needs help in their home, they can, click that button and the response center can send out the necessary help for that individual. In order to have the personal emergency response system services approved on your plan of service, you would want to have documentation which shows that you rent or own a home or live with unpaid caregivers, that the individual is alone for significant parts of the day, that the individual has no caregiver for extended periods of time, and that the individual would otherwise require extensive routine supervision. And you must be able to demonstrate that the individual will know how to use the device only in an emergency. The next service we want to talk about is transition services. And transition services are the goods and services that enable a participant who is exiting a nursing facility, a hospital, an IMD, or an ICFID, the Intermediate Care Facility for Individuals with Intellectual and Developmental Disabilities, to transition to a community-based setting. So if an individual is moving from an institution into a community-based setting, they would be able to access up to $2,000 for expenses that can't be met from another source. So these are things like if you need kitchen supplies and that sort of thing as you're moving into a new home, this service may be able to help provide that support for an individual. In order to provide those services or to get approved for those services, the individual has to show that they were in an institution for at least 45 days. And they have to demonstrate that the need cannot be met from another source. This service is part of our waiver services, but it actually is also being provided under the Idaho Home Choice program. And so we've got a link here in this document that'll link you over to the Idaho Home Choice program. So you can see more about the types of services and goods and services that an individual could receive as they're transitioning out of an institution and into those home and community-based settings. The next service that we want to talk about is supported employment. And supported employment consists of competitive work in integrated work settings for participants with the most severe disabilities for whom competitive employment has not traditionally occurred or for whom competitive employment has been interrupted or intermittent as a result of a severe disability. This is a service where an individual, when they find employment and they need support on the job, this is a service that would provide that support. In order to receive this service, you would just need to provide your supported employment plan. The next service we want to talk about is non-medical transportation for supported employment. Non-medical transportation under the health, safety, and employment services can only include transportation related to competitive integrated employment. All other non-medical transportation must be requested from the discretionary supports budget. So if you are looking for non-medical transportation services to go to the movies with friends, or to go to church, or go to a club, you would use your non-medical transportation mileage under your discretionary supports budget. But the department wants to encourage employment for individuals, and so as part of that, we want to offer the non-medical transportation. So if you need additional miles to get to and from your job, you can request those non-medical transportation miles on your plan, and we can add additional dollars to your budget to cover the transportation to and from your employment. In order to receive that, you have to provide the name and location of your employment, the address the participant needs transportation to and from, and the hours and general schedule of the participant to show the frequency of the transportation needed. And so with that, I'll pause again to see if there are any questions regarding kind of the traditional support services and the documentation needed for the department to approve those support services. I see one question that came in that asked, is the slideshow available online somewhere? At the conclusion of this presentation, we will make the slideshow available on the My Choice Matters website. There is a section called Training and Information. You can click on that and you'll be able to find the slides from today's presentation and previous presentations that we've already given on other topics. And the recording will also be made available. It just may take us a few more days to get that recording up onto the My Choice Matters website as well.
Karen, we also got a question that asks around the durable medical equipment, if that would also cover walk-in tubs to allow for independence and prevent injuries such as strains and back issues.
I actually do not know the answer to that question. Care manager. We may need to take that question back, Alina, and talk to our care managers about that. And then we'll be able to get a response on that.
Great. And I just want to remind folks to make sure we don't miss any questions that come in. If you put them in the chat, be sure to either give them to everyone or all panelists. That way we know that we're not going to miss any questions. If questions are just sent to one person individually or to all attendees, we could potentially miss those. I also see a question that asks if we will be covering the pre-vocational training information later in this presentation. The pre-vocational service is not an add-on service. That service is included in the budget, and there will be a separate training all about the new services that's also 1 hour long that is upcoming. So that is where you could go to get more detailed information about the new pre-vocational service. I'm not seeing any other questions, and I don't see any hands raised. So I think we're good to keep going.
All right. Thank you, Lena.
Oh, I'm sorry. One popped right up. A question asks also about glasses, noting that their son uses his whole paycheck to pay for them.
I will have to double check that answer as well, but I do not believe that glasses are covered under the specialized medical equipment. But we will I will take that note, Kathy, and I will confirm that answer. All right. Okay. So the next section that we want to cover, so we've covered the health, safety, and employment services that are typically covered under the traditional program. And now we want to take a look at those health, safety, and employment services that would be covered under the self-direction program. And as Alina mentioned early on in this presentation, the services and the supports that you can get are very similar across the traditional and the self-directed program. It's just that these categories have slightly different names and different ways to kind of request that, that service. So the health, safety, and employment services for the self-direction program are the employment services or the job supports, the JSS category. It is the adaptive equipment or the AEQ category. And it is specialized nursing services or that SNS category for the self-direction folks. So this is the kind of the comparison that Alina was mentioning earlier. Individuals in the self-direction program can receive skilled nursing and nursing oversight. That's the traditional name in the name of the service on the traditional pathway. It is that SNS category in the self-direction pathway. The criteria for nursing in the self-direction program is the same as it is on the traditional, but you would also need to provide a current license of the RN or LPN that is going to be providing the services. And the reason for that is on the traditional side, the nursing services are enrolled as nursing providers. And so Medicaid already has that information on all of their providers, whereas on the self-directed side, because individuals are contracting directly with their community support workers, Medicaid just needs to verify that current license for the individuals providing that service. The adaptive equipment category for the self-directed services, you can see here that it covers several of the items that would be considered traditional services. So under the adaptive equipment category on the self-direct program, an individual could get things like the specialized medical equipment and supplies. If they needed to make a modification to their home, they could do those environmental accessibility adaptations. If an individual needed home delivered meals or the personal emergency response system, all of those types of services could be requested under that adaptive equipment category for the self-direct folks. For specialized medical equipment, you'd have the same documentation as traditional, plus documentation from an occupational, physical, or speech therapist if the cost of the product is over $500. On the environmental accessibility adaptations, again, the requirements are the same as traditional, except that quotes don't need to be from those Medicaid approved providers. It can be from the provider you choose and choose to submit to us. For home delivered meals and PERS, the requirements are the same. Also, we mentioned that the folks under the traditional program could also get those community transition services under the waiver. Again, that doesn't, for self-directed folks, they can get the community transition management services through the state plan. Or again, as I mentioned, there's that Idaho Home Choice program right now that would also be available to individuals in the self-direct program for those community transition services. For behavioral consultation crisis management, if someone in the self-direct program needs services that are similar to that behavioral consultation service, That would be covered under the emotional support service category for self-direct, and would just require a request for a budget modification. And we're going to talk about that a little bit more further down in the presentation. The other services available to self-directed folks are the job supports, which is similar to supported employment on the traditional side. On the self-direction side, an individual must demonstrate that the support is not for volunteer, unpaid, or work below the prevailing minimum wage. We also have available to our self-directed participants is our transportation support service, which again would be for that non-medical transportation that an individual needs to get to and from their competitive and integrated employment. And that can be requested as transportation supports with that budget modification employment mileage form. And again, we're going to talk about what that budget modification would be further down in this presentation. Okay, so that covers the self-direction, health, safety, and employment services. Were there any questions on those services?
I'm not seeing any questions, Karen, and I don't see any hands raised as of yet.
All right. Okay, so if you remember back to at the beginning of the presentation, we talked about how individuals could request additional dollars for those health and safety services or employment services. And individuals can also request a health or safety budget modification. And so the budget modification allows individuals to get more services of the types of services that you would get using your residential or your discretionary budget if you need more than what those budgets can cover. So services with the possibility of a budget modification would be supported living services. So if you are not able to purchase the amount of supported living services necessary to meet your health or safety needs, you may be able to get a budget modification to cover more of those services. You may also be able to get a budget modification if you were in the traditional program to receive adult day health, developmental therapy, pre-vocational services, career planning, community rehabilitation, non-medical transportation, respite and chore services. On the self-direction side, you may be able to get a budget modification to purchase additional personal supports, learning supports, emotional supports, relationship support, and transportation supports. So how do you go about getting a budget modification based on health or safety? When you get your budget notice, in that notice, you will have a copy of a health risk form and you'll have a copy of a safety risk form. And if you need more of those services that would usually be purchased by your residential budget or your discretionary budget, you would fill out this form to identify your health need or your safety need to receive those services. You would identify the service that you're requesting, the type, the frequency, and the cost of the service. And you would go through, you would fill out this form and submit it with your plan of service to request that budget modification. Okay. So a budget modification for a health risk, documentation submitted with the request must establish a health risk and may include a primary care physician and our specialist progress notes. And these aren't requirements for the health risk form. These are things that may be included depending on the type of risk that you have and the best way to document that risk. But you could have progress notes, you could have a history and physical documentation, emergency room reports, fully notated seizure logs, diagnostic reports or nursing plans, or hospital discharge summary. For the budget modification for a safety risk, the documentation submitted could include current incident reports, police reports, assessments from a licensed practitioner of the healing arts or a professional licensed by the state of Idaho, whose assessment is within the scope of that person's license. It may also include status reports and implementation plans that reflect the type and frequency of interventions in place to prevent the risk and the participant's progress under such interventions. When you request services because of a health or safety risk, there typically can be approved if they include the following information. So for your health risk, the health risk to the participant, you have to identify the health risk to the participant without the requested services. So if the participant didn't receive the services, what would that health risk be? You need to identify the specific services being requested to address that health risk. And you need to identify how the requested service will address the health risk. And then provide documentation from a licensed professional within their scope of practice and documentation that demonstrates the health risk without the requested service. Similarly, for the safety risk, you would have to identify that there is an imminent or likely safety risk to the individual. You need to specify those services being requested that specifically address the safety risk. And you'll need to tell the department how that service will address the risk. And then provide documentation from the licensed professional within the scope of their practice and documentation that demonstrates that there is an imminent or likely safety risk to the participant if they don't receive the services. Are there any questions on that portion of kind of the health or safety budget modifications?
There's another question noting that the pre-vocational service is mentioned under budget modifications. They note that their support broker is currently putting together my daughter's SSP. As I understand how the system is set up, these budget modifications need to be done now. Where could I go to find out more information about the pre-vocational training? If they would prove helpful, I need to include them in our SSP now, correct? I can take a first stab at that, Karen, if you then want to continue. So the new pre-vocational service is a new service that's specific for traditional. So since you mentioned that your support broker is currently preparing the SSP, I'll note that the kinds of supports that would be available under the pre-vocational training service would absolutely be available for your child to add to their plan under self-direction, because there is just more flexibility in self-direction. So it would simply be about providing a goal around the kinds of pre-vocational supports or the kinds of learning that your daughter would like to do to help prepare her for employment, and then identifying an appropriate provider. You would only need to complete a budget modification request if there was insufficient dollars in your daughter's plan for her to obtain that service within the budget itself. Since the new model is not moving forward yet, if the SSP is currently being developed, then your daughter has available her current KW budget to develop that plan. So if there's an interest in finding a provider who would be well suited to provide the kinds of pre-vocational support that perhaps your daughter's interested in, it would be about finding and contracting with a provider who could provide that support. There are definitely some employment support providers who do provide support on the self-direction side as well. And so that may be a good mechanism for finding someone who would be well suited to provide pre-vocational support to help meet your daughter's needs in the more immediate.
Great. Thank you, Alina. I don't see any hands raised. I'm not seeing any additional questions, so I think we'll move on. So that kind of concludes the main content of the presentation today. If you have any other questions, again, we're going to post this presentation onto the My Choice Matters website. If you have any questions, you can contact your quality assurance specialist in the region that you live in at the information on this slide. We also note that you can also find more information on the My Choice Matters website, and you can follow this link here, ourhealthandwelfare.org. Also has additional information on the new resource allocation model and services for adults with developmental disabilities. You can find more information on just the health and welfare site, specifically about services for adults with developmental disabilities. Next, well, okay. Put you back down there. We are going to put we have a short survey about this training, and we're going to put the link in the chat here in just a moment. I don't know if I can, every time I do that, that's what happens. Let's see here. Let me get this out for you. Okay. Let's get this into the chat. If you want to click on this link, it will take you to the survey where you can let us know if there's information that was missing from this presentation, or if there's still other questions that you have that we may be able to address in future presentations. We also have, we were planning to have a training on how to understand your new eligibility and budget notices that was scheduled for tomorrow. Please note that this training has been postponed, but it will be rescheduled. We just want to make sure that we have the most current information possible about those budget notices. So we're going to hold on this one for just a little bit. So our next training coming up will be a training regarding the available new services. I know there were some questions about the pre-vocational services. This presentation will provide more information about that pre-vocational services and all our other new services. So look for that on June 30th from 11 to noon Mountain Time. You can also find a list of all the training sessions on the My Choice Matters website as well.
We had one more question again, asking for clarification on the pre-vocational service. So I can just quickly address and provide a little explanation about what that service is for. So the new pre-vocational service is a service that's specifically to help support individuals to gain transferable skills that would be supportive or helpful in obtaining employment. So these are not skills to learn how to do a specific job, but really more skills that are useful in any kind of job. So if someone needs support learning how to navigate transportation to get to a workplace, how to get to places on time, or how to interact appropriately with coworkers or customers, these are all kinds of supports that could be provided from the pre-vocational services support. This service is available on both an individual and group basis for individuals who have similar support needs, but it is a time-limited service. That service can only be provided over 2 different plan years for a grand total of 520 hours. The reason for that being a time-limited service is because the goal of that service is to to help someone move into competitive paid employment. So it's to help gain some of those skills necessary to position them well to go out and start seeking work and then getting more specific supported employment supports, be that through the Office of Vocational Rehabilitation or by obtaining an employment independently, for which they would then potentially receive supported employment supports.
Great. Thank you, Alina.
One follow-up question asking who provides those services. So for the pre-vocational service, the targeted provider type for that service are individuals who provide supported employment services. So a number of supported employment providers have been in contact with the department to sign up for and add pre-vocational services to the array of services that they offer. So it would be possible perhaps for you to contact the department and identify who has requested to start taking on those services, to then inquire if perhaps they would be able or willing to provide that service for somebody using self-direction versus somebody using traditional. Again, just remembering these new services are not yet available. It is all dependent upon the new model being approved by the Centers for Medicare and Medicaid Services. So access on traditional to community habilitation, pre-vocational services, and career planning is dependent upon that approval and then being able to move into the new model. There's definitely a little more flexibility on self-direction. So somebody could obtain a service like pre-vocational services using their self-directed plan by identifying a provider who could then offer that kind of support.
And when Alina talks about contacting the department, on the slides from today, when we get those posted, again, you'll want to contact the quality assurance specialist in the region that you live in, and they'd be able to possibly help identify providers who are willing to or who have expressed interest in providing that service. And I did add a revised link to the survey. This one should be working now if you want to click on that link to respond to the quick survey. I think it just takes a couple of minutes to respond to that survey for us, and any additional information or questions you can provide to us would be greatly appreciated, because if you have the question, it's likely other individuals have that question too, and we want to make sure that we're addressing all of your questions and concerns as we move towards implementation. And so with that, I think we'll leave this link open for just another minute or so. And we will go ahead and end this presentation. So thank you everyone for attending, and we look forward to having you in one of our future training sessions as well. Hope you have a good afternoon.